Hi, this is Dr. Kang, Scuba Diving Stories. Today the story is about fatty liver. I have a friend, a doctor friend who dives, and he was diagnosed as fatty liver. Was very disappointed. He was in despair and wrote me an email if he can dive with this diagnosis. My response was, of course you can. But there's some stories that I like to share with you. Believe it or not, of the whole population, 25% have a fatty liver. So it's almost like a PFO. In one setting, there are more fatty liver than common cold. And this certainly needs some attention. Fatty liver. This is from my Q&A on a website, and he was asking some question on fatty liver and diving. But anyway, we'll talk about what fatty liver is, some types, causes, symptoms, diagnosis, prevention, and treatment. Or is there anything you can do about it? So, fatty liver. Fatty liver is a disease with too much fat in the liver. Problem is it can progress to liver failure. So there are a couple of types and causes too. So it's either non-alcoholic fatty liver or it's alcoholic fatty liver. There are two types. Non-alcoholic, of course, is more common. And if this goes on, can lead to severe version called non-alcoholic steatohepatitis. So fatty liver becomes hepatitis, which means it's getting worse and worse. Liver gets swollen and then can go to cirrhosis, can also go to cancer. So this is a non-alcoholic fatty liver disease, is a leading reason for liver transplants. Causes are unknown. Nobody knows exactly what happens to this disease, but overweight and obesity, diabetes, high cholesterol and triglyceride in the blood, hypertension, hepatitis C especially, or other hepatitis as well, are related to non-alcoholic fatty liver. Some medications like steroid, anti-cancer drugs, heart drugs, they have liver toxicity. They can damage liver function. Mostly appears in middle-aged, but in all ages, even in some children. While alcoholic fatty liver, if somebody drinks more than 1 or 2 drinks, 1 female, 2 male, every day, gradually fatty liver comes. Alcohol through the metabolism becomes triglyceride. So no wonder alcohol causes fatty liver. Obesity has a lot to do with this disease. Female or women have more fatty liver than men. So if somebody is obese woman, it's a high risk group. Obese woman drinking a lot, probably the highest incidence group. Genetics It's suspected but not yet confirmed. So if you keep on drinking with alcoholic fatty liver, this will lead to alcoholic steatohepatitis, cirrhosis, liver failure, and eventually even cancer. If you have a fatty liver, how you feel, what kind of symptoms do you have? Most of the time there are no symptoms. That's why people ignore it and let it grow. Some people complain of pain and pressure on middle or right side of abdomen, which means it's beginning to show some symptom. They feel fatigue, loss of appetite, and certainly loss of weight. So how do we diagnose fatty liver? We do a liver function test. It's a blood test showing SGOT, SGPT, and many others, and check if liver function is still okay. Ultrasound shows fatty liver, CT as well. And if we really need to confirm it, we do the biopsy. We need the needle biopsy instead of cutting the abdomen and taking a part of the liver out. And this is the result of liver function test. And this is about the treatment. There is no medicine specifically for fatty liver. What about anti-cholesterol drugs if the liver is full of fat? It could work, but some of those drugs have hepatotoxicity, which means it's toxic to liver function. So then what can we do? Here's something we can do, Let's see, probably prevention is the best thing. We exercise regularly, have some nutritious food, just forget about junk food, eat a lot of fruit and vegetables, limit the alcohol. And you need to be mindful of hepatotoxic medications. Some steroid, some anti-cancer drugs, some hypercholesterolemia drugs, they show hepatotoxicities. We should take care of our health. I looked like this about 20 years ago, and my wife looked like this now. Take exercise. We can never overemphasize the importance of maintaining our health. So do go out and work out. This is about what we can do to protect our liver. So get some shots for hepatitis B, influenza, pneumonia, papilloma shot. This helps. So just be a little kind to your liver, spend some money, and get those shots. And whenever you begin to take new medication for whatever reason, you have to ask the doctor who prescribed that if it is okay with liver, and you should also ask your liver doctor and make sure it is not toxic to your liver. We should lose weight, healthy eating, and be more active, exercise. If you lose too fast, sometimes can make fatty liver worse. So maybe 1 or 2 pounds per week is okay. I would say like 500 grams per week. exercise. At least 30 minutes walk every day. Stop drinking. Probably the most important thing for fatty liver, especially young age. If you find the fatty liver in you while you are still 20, 30, 40, this is very serious. So you really have to think about stop drinking. That also helps non-alcoholic fatty liver as well. So this I thought was a very interesting picture on SNS, and it's before stopping alcohol and after. I'm glad he shared it on SNS. This is my version. Do SCUBA. Do live happy life. If you do SCUBA, you really have to maintain your health. So these are my friends. My wife taught, and we've been diving together for several years, and I miss you guys. This is the picture that I really like. Divers giving water to diver. Make sure you drink a lot of water too. So I talked about what we can do to take care of fatty liver. So I would rather say don't drink. That will be the most important thing for fatty liver. Talked about fatty liver today. Symptom, no symptom at the beginning. By the time you have a symptom, it means maybe it's getting too late. So try to prevent them, and to treat, don't drink. And it was today's issue, and I thank you very much for your attention.